Hello, it's Susan here, Susan Douglas Scott, Chair of the Board of NHS Golden Jubilee, and I'm on this month to talk to you about the fact that I can't believe I'm saying this actually, that it is almost a year since we went into national lockdown from March last year, 2020. And I know it's been a tough year for many people, particularly those people and families who've lost their lost ones to the virus. And my heart goes out to all of you if that's been something that's affected you or somebody that you know. But I wanted to talk to you a bit about the things that have happened at the Golden Jubilee over that time. There's been a lot happening, and despite all the challenges that we've faced, we have continued to develop and grow and to deliver excellent services for the people of Scotland. The interesting thing has been that there are sometimes in these difficult times that you can be innovative and you can learn, and I hope that's what you'll realise that's been happening, and that we'll continue to do these extra and good things that have come out of this year of hard work from our wonderful staff. So this is the 19th of March today when I'm recording. So tomorrow, the 20th of March last year, was the last day that we stepped down from doing elective surgery, and that's the planned operations that we do at the Jubilee. And prior to the pandemic, the main ones that we focused on were orthopaedics, hip and knee replacements mainly, and cardiac surgery and thoracic surgery for the west of Scotland, and also ophthalmology, cataract surgery. And during the time of the pandemic, we have continued to finish our new 6-theatre ophthalmology, spanking new, fabulous, wonderful, accessible building that we'll be able to provide a further 18,000 cataract procedures for the people of Scotland. So we managed to, despite the pandemic, we managed to finish that. And that building has opened, and it is absolutely beautiful. It's a beautiful space for patients to be in. It's a lovely space for staff to work in. But importantly, it's modern and it's got all the up-to-date facilities that the ophthalmology teams need in order to offer the best treatment to the patients that need it. So that's been a fantastic thing. We also responded by doing a lot of planning. So when we stopped on the 20th of March last year doing our elective surgeries, we did carry on with our cardiac and thoracic, our urgent surgeries, because that was important that we did that because these are life-saving procedures. But we did stop doing planned heart and chest operations. So during this time, our executive team worked very hard with the Scottish Government, talking to other colleagues across the territorial boards about what was going to be the best way for the Golden Jubilee to contribute to the care of people in Scotland during this time. And of course, at that point, we didn't imagine for a minute that it was going to go on for a whole year. So what we decided would be best, looking at international efforts and what had been best practice elsewhere, was that we maintain one COVID light site in Scotland, and it was decided that would be ourselves. And the reason we say COVID light is because you know the nature of the virus now. We've been living with it for this year. It's very sneaky, and some of our staff and some patients coming in for procedures potentially could have that virus. We do lots of testing, as you can imagine. We've got whole systems set up, and all of our staff now are very versed in wearing full PPE and keeping themselves safe. And what we said to the government was, well, if you need us to do other types of surgeries than we normally do, let's talk to our colleagues in the territorial boards and see what they need the most of. So actually it was cancer surgeries that were really being difficult for territorial boards to get through, to keep those patients safe and to allow them to have their surgeries. It was best that they came to a COVID light site. So we've done a lot of work with those teams. Sometimes those teams have come across and they've done the procedures with a bit of support from our staff, and sometimes we've been more involved just perhaps with one surgeon that's come across. So it's been a really flexible way of working, and we've also opened 2 new wards to accommodate the numbers of people that have come through the door during this time, because usually what would happen at the Jubilees, if you needed an operation, you would come and have that surgery, and as soon as you were fit enough to move back to your local hospital, that's what would happen. But that's not been safe to do, so we've had more people staying for a little bit longer. although we always try to make sure that people's stays are as short as it's possible to be. The other thing we've introduced with our teams is a bit like what I'm doing with you today, a virtual talking to people. So there's a programme now called NearMe, and NHS have that across the country, and we use it also. And it means that we can run our clinics virtually. And that means that, as you can understand, visiting and coming to the hospital with somebody else is not usually possible unless you need a lot of support. So people were having to come by themselves, and that's difficult, isn't it? So by using NearMe, it means people don't have to travel, and also they can involve their family or friends or supporters in the discussion with the consultant, and that offers a much more breadth of conversation and a depth to it and a better understanding. And so people have been very pleased with the outcomes of that and getting access to their surgeons. So in July, in the summertime, we reintroduced elective surgery, and we have caught up on the people that we had planned to operate on from March through to July when we weren't operating. We've managed to catch up in all these and are taking new referrals again. So we're very pleased for those people that they've had their life-enhancing surgeries, because the pain of living with a knee or a hip that requires replacing is just indescribable for people. And a lot of people were also having real trouble seeing because they were waiting for their cataract operations. So it's been fantastic to be able to do that, and the planned heart and lung operations that make such a difference to people also. But we're continuing also to work with our colleagues during this second lockdown, and as the pandemic has continued, we're still doing cancer surgeries and working with people across Scotland and that, and also a range of diagnostic procedures also, which is going to help people get the treatment that they need. So I'm so delighted that all of my colleagues have worked so hard over this time, have come up with ways of making sure we keep you safe. The hospital looks quite different now. You walk through, you're asked to use hand gel and to have a mask on, and all of those things that people now take for granted that you would expect. We've also been supporting NHS Louisa Jordan and a number of our hotel staff, because at the Golden Jubilee we're unique in Scotland in the NHS in that we have a hotel also, and that's closed to the public now. So they have stepped up also and have willingly stepped in and been trained in clinical patient-facing roles. Some of them at the Jubilee, and quite a few have gone to work at the Louisa Jordan as well, where you might bump into them if you're called there for your vaccination. But we've also been supporting diagnostic services at the Louisa Jordan. So it's all about partnership working. It's all about thinking things through. It's all about saying life has to go on, and your health, people's health matters during this time. So the fact that we've been able to progress and also to develop during this time, I think is an amazing thing. But I really hope that you are safe and well, that you'll continue to do so, that you're either have had your vaccination or are looking forward to getting your vaccination. The science that's gone into that, the speed that's gone into that is absolutely fantastic. And as we face the anniversary of the pandemic in Scotland and the year of lockdown, I know the First Minister will lead us through a minute's silence to remember those who we've lost in Scotland and globally to this terrible virus, and also the impact that it's had on so many people's lives, on the economy. And we all look forward to the easing of lockdown that's now starting to happen, where we can start to be out of our houses more, we can start to meet up with people again, and hopefully maybe in the summer even get to hug our families and our friends and spend more time together. So until then, as I say, stay safe, stay well. It's been lovely talking to you. And if any of you ever have any questions, please just get in touch. We'll be more than happy to talk to you about what we're doing here at the Golden Jubilee. Bye just now.